You're listening to Talking to Teens, where we speak with leading experts from a variety of disciplines about the art and science of parenting teenagers. I'm your host, Andy Earle. We're here today with Gregory Scott Brown talking about mental health. A funny thing happens when you ask people about mental health. The things that generally come to our mind are often really mental illness. We think about things like anxiety or depression or suicidal thoughts. Mental health is about being mentally healthy, and the way that we support our mental health is through self-care. Self-care is one of those buzzwords that a lot of people are talking about, and we may have some preconceived notions about, but Dr. Brown breaks it down into 5 key pillars and walks readers through how those can support our mental health. His new book, The Self-Healing Mind, is a great guide to those pillars, and he's on the show today to talk to us about those 5 pillars of self-care and how parents can incorporate those into our families and support our teenagers' mental health. Dr. Brown is a board-certified psychiatrist and affiliate faculty member at the University of Texas Dell Medical School. His commentary has been featured in the New York Times, Huffington Post, and today he is our guest on the Talking to Teens podcast. Dr. Brown, thank you so much for being here. I loved your book, The Self-Healing Mind, an essential 5-step practice for overcoming anxiety and depression and revitalizing your life. Yeah, you got me thinking about a lot of stuff in here. I'm super excited to dive into it.
I'll tell you, we're all thinking about mental health, but we're not talking about it enough. So I'm just so happy we're having this conversation.
Well, so what led you to write this book, or what kind of was the impetus that got you on this path?
I actually started writing this book during the COVID pandemic. And I'll tell you, that's a time that really changed, I think, the way most of us think about mental health. I think before the pandemic, some people might have thought, okay, there are people who are depressed, there are people who are anxious. But then during the pandemic, it's like social distancing. We're all staying at home. We're scrolling through social media, and we're definitely feeling the impact more. I thought that was my life changed personally, too. Again, prior to the pandemic, I was going to the office. I was meeting with my patients there. And during the pandemic, I found myself using a lot more video calls and telemedicine. I had some more time on my hands, and I thought, what better way to really communicate to more people about mental illness and mental health than to write a book about it.
That's one thing, actually, just that I found really interesting in your book is sort of defining mental health. What does that mean? And it was really interesting to me, kind of thinking through this, that, well, a lot of the things we think of when we think of mental health are actually really not health at all.
And there's a difference there, because the thing is, when you think about physical health, if you just mention those 2 words, most people will think about, okay, I need to eat healthy. I need to, working out, taking care of my body. But then when you mention these words, mental health, I find at least most people start thinking about depression, anxiety, suicide, right? Which are all really important topics, but there's not really that same type of motivation to take care of that the way we would necessarily take care of our physical health. I challenge readers here in the book, to really distinguish between mental illness, which are these diagnosable things like depression, anxiety, PTSD, and mental health, which is really the driving force that motivates us, that determines the quality of our relationships, how we interact with each other, how we love. That's really what mental health is all about.
I love that. Yeah, it just it seems like they feel synonymous, mental health and mental illness, but they shouldn't be. It's a totally different concept.
Right. I mean, and the thing to keep in mind here is that if we're focusing on our mental health, right, we are also reducing our risk for developing mental illnesses like depression or generalized anxiety disorder or what have you. But again, even if you're not diagnosed or you've never been diagnosed with a mental illness, mental health is still something that is valuable that we should all be paying attention to.
Well, talk to me about this title, what the self-healing mind. That's kind of counter to what you do as a psychiatrist. You help people heal their mind, right? If the mind can self-heal, then you're putting yourself out of business here.
Well, I mean, in some ways that would be great. Imagine if suicide didn't exist in the world, and no one was depressed and no one was anxious. I mean, I think that would be something that we would all welcome. But when you're really diving into what the title is implying here, and what I intended by the title is that there are a lot of things that we ourselves can do to help the mind heal, right? And I talk about the 5 pillars of self-care in the book: sleep, spirituality, nutrition, breath work, movement. I mean, these are things that we all potentially have access to if we're alive and if we are listening to this podcast and we have a brain, right? It doesn't cost a penny to breathe. It doesn't cost anything to move our body, even if we're doing some stretches in our chair. And there's tons of evidence supporting that these simple strategies that may seem like common sense, if we utilize them the right way, they have powerful healing potential when it comes to improving our mental health.
Something really profound to me is you talk about this idea that we could take a drug that's going to like make us feel better, and sort of the problems with that. And I really love some of the stories that you have in the book, some examples from some clients that you've worked with, but kind of that seems to be like a theme. We want to feel better. We don't want to feel these feelings so they don't feel good. But you really kind of got me thinking about it in a deeper way, that maybe there's a reason we're feeling those things. Just erasing them isn't necessarily the answer.
Right. I mean, and the thing to keep in mind to this idea of broken brains and chemical imbalance is also timely. I mean, we're coming on the 35th anniversary here of the FDA approving Prozac for depression, right? So the Prozac revolution, this idea that, and again, nothing wrong with Prozac. I prescribe Prozac almost every week for my patients. It saves a lot of lives, right? But this idea that if we take a pill, that's just going to automatically erase all of our problems. It's going to erase our experience with anxiety. It's going to erase any negative or unwanted moods we may experience is a fallacy. It's not necessarily true. When I'm talking to my patients who are struggling, I often describe to them that being depressed or being anxious is kind of like being stuck in a ditch. A medication, like an antidepressant, is kind of like a ladder that can help you get out of that ditch. But then it's a matter of these self-care strategies that I talk about that's going to help you stay out of the ditch. And sometimes you need self-care plus medication. Sometimes medication or self-care alone will do it. But we should not undermine the importance of self-care. It's very important to help sustain mental health.
Yeah, I love that metaphor. So as a parent, looking at your teenager and just seeing them being in pain or seeing them struggle with something, I think it's just, you just want them to feel better. You want to make them help. How do I just help them stop feeling bad? I wonder what you think is how we could reframe that, or what's a more productive kind of way to approach it or think about it.
Yeah, I mean, it's an excellent time, I think, to get people really not only thinking about mental health but talking about it. I would say those teenage years in particular are really important years as far as getting conversations going. I would say communication is probably the most important thing. I think especially when you think about something like suicide, right? Unfortunately, there are over 140 suicides on average every day in the United States alone. And there is something called the suicide contagion effect, which essentially means if a teenager or young person, although you can't see this in adults as well, but if a young person learns about a suicide through the media, or they have a classmate who dies by suicide, then certain populations might be a little bit more vulnerable to mimicking the act, right? The thing is, oftentimes parents are nervous, and duly so. I mean, during those periods, they're afraid to have conversations with their kids.
Yeah, so then we shouldn't talk about it. So
But the thing is, research actually shows that there's certain ways to have those conversations, and that if we're having those conversations where we're talking to our kids about mental illness or even something as unfortunate as suicide, we're not glorifying the deceased, right? We want to make sure that we're not doing that, and that we're encouraging our kids to speak up and to ask us for help if they need it, that it actually reduces their risk of mimicking that type of behaviors. Conversations are really, really, really important with our kids, especially when it comes to mental health and mental illness.
Tips that you think parents could keep in mind in having conversations around suicide that are more productive or more likely to lead to those positive outcomes?
Right. And again, just to reiterate this, so the most important things are we don't want to glorify the deceased. So if they're coming to us and they're talking about, hey, I have a friend that I learned about in school, this is something that happened, that again, we're allowing our kids to process the event with us, but we're not, again, glorifying the person's life or the manner in which they died by suicide. We want to make sure that we're avoiding that. We want to make sure also that we are encouraging our kids to get help, to ask for help if they need it. We're talking about meeting with therapists, meeting with the school counselor, meeting with the psychiatrist, and normalizing that. Saying this is something that a lot of people need. It doesn't mean that something's wrong with you. It doesn't mean that you're not strong. It's the right thing to do. And again, if we're teaching our kids that at an early age, then we're preparing them for some of these challenges they may face in their lives as they get older.
Talk about self-care. You've mentioned a few times now in the 5 pillars, right? Also, you talk in the book about just how self-care kind of has some connotations around sort of I love this paragraph you have here. It often evokes images of spending a weekend at a spa or high-priced holistic medicines. There's kind of some, I don't know, connotations that we have around self-care. What do you really mean by that? Or
I will be the first to acknowledge I love a good spa and I love a good massage. So, hey, there's nothing wrong with that, right? But we want to make sure that when we think about self-care, that we're not characterizing it as this elitist sport and saying that you have to have money for self-care, or self-care is only a reward for hard work. I'll burn myself out, and then if I work hard enough or earn enough money or whatever it is, or get the promotion, then I'll take some time for self-care.
now I deserve it. Yeah, right.
Right. So self-care is actually, and this is really important. I mean, if you take anything away from this episode, self-care is evidence-based medicine. Even if each of us we take between 20 and 30,000 breaths every single day, right? And with each inhale and exhale, we are potentially increasing GABA in our brain. That is a neurotransmitter chemical that helps us relax. It helps us slow down. It helps us feel a sense of calm and peace. We're enhancing alpha wave activity in the brain. These are physiologic markers of relaxation and rest. But we have to learn how to manipulate our breath in a way that can actually do that, right? Self-care is something that we should definitely not take for granted.
I love how in your chapter on breath, you talk about how breath affects the nervous system. I thought it was really interesting to see some of the research on the links there, just how connected it is.
Right. Again, with breath, I'll tell you this. One of the stories I have I was covering an inpatient unit when I was living in Austin. And I'll tell you that I got a call from one of the nurses that a patient come in, she was having a panic attack, and the nurse was asking me for a medication to help her relax, right? And almost reflexively, as doctors, will okay the order and then go on about our day. But I remember on this particular day, I was just starting to learn about some of the science behind the different breathing exercises, 4-7-8 breathing, pranayama breath, coherent breathing that I outlined in the book. And I remember I went down to this patient's bedside and I sat with her, and we actually practiced some of these techniques together. And within a matter of 5 minutes, I mean, she was calm, she was relaxed, and she didn't need the medication, right? And again, it's not to undermine or devalue medications. Like I prescribe medications, they definitely have their place, but so does self-care. And it's important for people to realize that they can have a profound effect.
Yeah, because I find just it's like when you find yourself feeling anxious and stressed out, all of a sudden I notice my breathing is really like I'm kind of almost panting a little bit or taking more kind of shallow breaths. So it's like it's obvious that there is a link between our nervous system and our breath, but I think we maybe we don't give it enough credit or realize that we can take control of it.
And I think it's also important that we don't wait for ourselves to have a panic attack or to hyperventilate to practice some of this stuff. I mean, if you're going through the book, I mean, anyone who's tried a yoga class before will kind of understand what I'm talking about. I mean, if you just go into yoga class and you're flowing through this sequence and you're not paying attention to your breath, I mean, it doesn't really matter how in shape you are. I mean, it's going to be a lot more difficult. I mean, you'll find yourself gasping for air, right? One of the things that I like so much about yoga, it's that it brings you into this state of conscious awareness where you're connecting breath with movement. So your yoga teacher will often instruct about how to breathe. Your yoga teacher might talk about pranayama breath during the class. So as you flow, you're consciously aware of those breaths. And I find that being able to practice that type of breathing on the mat, off the mat, in between patients for me, in between meetings, actually helps me in those moments where I do find myself anxious or hyperventilating or gasping for air, because I've been through this what seems like hundreds of times. So again, it's okay to practice it before you get to that point where you actually need it.
And I like how in the book you really provide sort of a toolkit of different breathing techniques that people can try out and use. It's not about, hey, here's how you should breathe or here's what you should do. It's really about kind of, exploring how what that connection is and how different ways of breathing can actually change your mood or change the way that you're feeling. And by kind of getting all these things in your arsenal, it's like you're getting equipped with, more strategies that you can use, which is really powerful.
Right. I mean, the other thing that breath work does is in those moments where we feel like we're at the end of our fuse, or we're going to lose our cool, or maybe we're feeling tired, or whatever it is. So breath work can kind of buy ourselves some time in those moments and give the perception that things are just slowing down. And you can often see just buying yourself 3, 4, 5 minutes with breath work can end up changing the entire tone of a conversation, could change the entire tone of your day.
What do you think is a good way for parents to introduce this to teenagers or to maybe model some of these self-care things, but with breathing, maybe it's something you could kind of do together almost or
Totally agree with you. Yeah. Doing it together. Yeah. I think, and the beautiful thing about this is the book and the techniques in the book, they have no age limit, right? I've had folks that I've spoken with, my patients, who've told me they practice some of this stuff with their kids. My dad, who's in his 80s, likes to use 4-7-8 breathing. I mean, that's one of his favorite techniques out of all the techniques that are there in the book. But I think it's definitely something that you can do together. 4-7-8 breathing is a great thing to do before bedtime with our kids to help them just kind of settle in, help right? Maybe doing a couple of rounds of that together. But yeah, I mean, start where you can.
Oh, I like that. Yeah, there's a number of things in here actually that could be incorporated into like a wind down routine at the end of the day that would, I think, is really powerful. And yeah, a great way to just start every day kind of reinforcing these behaviors and modeling that as a way to calm yourself or change your emotional state.
It's all about social and emotional learning too. I mean, self-care is really helping instill those skills within our kids as well as within us.
We're here today with Dr. Gregory Scott Brown talking about the 5 pillars of self-care and how those can support our teenagers' mental health. And we're not done yet. Here's a look at what's coming up in the second half of the show.
Teenagers, not unlike adults, they're curious, they're exploring. I mean, the most important thing is be there to answer their questions. Again, to encourage conversation is so healing. If there's resistance, to explore where that resistance is coming from. Maybe it's coming from a conversation or something someone said to them at school, or something they read in a book or saw on TV. I think it's important that we're talking to kids. There's a study that found that patients who were depressed, who continued their treatment as usual, but changed the way they ate to include more of a Mediterranean diet, had better outcomes when it came to improving their depression. We can change our mood, or start changing our mood, by beginning to change what's on our plate. So sleep and mental illness, they have a bi-directional relationship. They affect each other. But for whatever reason, it's like we don't spend as much time being as intentional as we could about sleep. Making sure the room is cool enough, that it's not too hot. I mean, these are things that can improve sleep quality as well. Something that's also important when we're talking about kids is screen time too. Seems like it's cliche at this point, but there's science behind it. Green and blue wavelengths of light that are emitted from our televisions and smartphones actually make it more difficult for melatonin to be released in the brain. That can inhibit sleep quality as well.
Want to hear the full episode? Head over to talkingtoteens.com/register for a free trial of our premium podcast. You get exclusive access to loads of great content with no obligation. And your membership supports the work we do here at Talking to Teens. Get started today with a free trial over at talkingtoteens.com/register. Thanks for listening. We'll see you next week.